I was introduced, I'm a university professor. I tend to talk a lot. So if I'm going over time, Diane should be giving me a sign of just stop talking. So just wanted to let you know. So today, I'd like to talk about health literacy. This is the theme of these sessions. And I'll try to make it more relevant to the Alzheimer's disease and the related dementia. But you might be, in a way, disappointed because we know actually pretty little. So you'll see how that happens. So I would like to start with three very short stories and just give you my background and then relevance to the health literacy. So I'm originally from Japan, and I've been living in the US almost 20 years. And then when I came to the US for the first time, I landed in O'Hare Airport, Chicago Airport, and then I wanted to order a cup of coffee. And I was in the line, and it came to my turn, and I wanted to order a cup of coffee. And then at that very moment, I realized that I don't know how to do it, right? I don't speak anything in English. Then, after going through some thoughts, an awkward moment of silence, I decided to say something, but I just couldn't say anything. So I walked out. So the point for this kind of like personal experience is that I was able to order a cup of coffee back in Japan, but all of a sudden the environment changes, language changes, right? So I don't speak their language, and I don't know how to do things in a different culture, so I couldn't do it. So that's sort of the point. The other experience related to today's theme was that, so I usually go back to Japan every year or so, and both of my grandparents are from the small town, west side of Japan, so we usually go there to visit them. And my maternal grandmother had Alzheimer's disease, and after my grandfather passed away, she became depressed, and then her Alzheimer's disease progressed pretty fast. And one summer, when we went to her house, she was sitting in front of her house, right? And then I greeted her, and she just asked me who I am. So that's the very moment that sort of my first interaction with someone with Alzheimer's disease, and how that's like to interact with them and how I felt. Obviously I read about it, I watched the movies, and then there are I went to lots of lectures about Alzheimer's disease, but that was my first encounter in person. So that sort of signifies how I see the Alzheimer's disease and the related dementia. And last short story was about healthcare. So I love playing sports, but for the graduate school and all other things, I stopped playing for some time. But when I played, my right knee started hurting. That was a long time ago. So I went to see a doctor, first time in the United States, right? And then doctor told me, at that time I was able to speak a little bit of English, so we were able to communicate, and the doctor recommended that I should get MRI taken, right? Okay. And I had no idea how this works in the United States, so I kept asking questions. So when can I make an appointment? Does my insurance cover it? How much does it cost? Right? So that's basic questions. And then doctor told me you should ask the question at the front desk. So I went back to the front desk, asked questions. I couldn't get the answer. So I kept calling them, emailed them, trying for a couple of months. Finally, I get the answer. The answer was somewhere between $2,000 to $9,000. So I was like, okay, I can't afford this. So the sort of point about this story was that I knew how to speak the language. I sort of know how to communicate with people, but at the same time, I was very new to the healthcare systems. Because of the context, I couldn't do what I needed to do. So just wanted to give you some personal experience related to today's talk. And as a side story, I was not going to say this, but when I went back to Japan, I know some of you might be familiar with the Japanese healthcare systems. So I didn't have insurance at that time because I was living in the US. So I went to see a doctor anyway, and then doctor told me the same thing, you need MRI. And so I got MRI next couple of days, and then I got follow-up consultations. And can anyone guess how much that cost me? Good guess. It was like 90 US dollars without insurance. Right, so that was quite an experience, right? 2,000 to 9,000 to $90. So if you are thinking about getting MRI and your insurance doesn't cover, maybe you'll just pay for the flight ticket and go. It might work. And obviously, there's a language barrier, etc. But so that was just my experience. And okay, so given those three stories, you kind of getting the sense of like what I'm about to talk about, health literacy and healthcare context, and then a little bit about Alzheimer's disease and the related dementia. So these are the formal definition of health literacy. These are basically the set of abilities to find, understand, and act on health information and the services to inform health-related decisions and actions for themselves and others. Up until 20, 30 years ago, the health literacy was considered as individual characteristics. So, and all the responsibilities of being able to read, understand, and use health information was on individuals. But around 20 years ago, 25 years ago, the researchers, major health organizations started realizing that it's not just about individuals. Context, environment matters. So now we have this relatively new concept of organizational health literacy. So even though you are able to do certain health-related tasks at home or in a familiar environment, when you go to see a doctor or hospital clinic, all of a sudden you get nervous and you couldn't ask the right question. You couldn't understand what they were trying to tell you. So these two layers of health literacy, personal and organizational levels, those are the critical ideas that we all should have. So this might sound a little bit more academic interpretations, but I think this type of underlying concept will help us understand whether you are professional healthcare providers or social workers or caregivers. I think this type of concept would really help think through how we can approach to this health literacy. And here is first test. So I would like you to just take a quick scan at this document and see if you can understand what the point is. I'll maybe give you like 30 seconds. I know this is probably too small to read for some of you, but time is up. So what's the point from this statement? Does anyone give me like one sentence summary? It's not easy, right? So this is not a very good organizational health literacy material. And the point was the following. So basically it said, don't worry, you don't get sick from the infected cows, right? So that was back in early 2000. There was a mad cow disease outbreak. And if you read any Chinese characters, these two characters means beef. So interestingly, early 2000, all the custom inspectors at any US airport knew these two Chinese characters. So as long as you have the product that has those two Chinese characters, they would take that away from you. I don't know if that's still the case, but it was like that back then. So just wanted to share this. Okay. So what's the problem with low health literacy? So when you don't have sufficient health literacy skills, what happens? So you might misuse medications, right? Because you can't understand the instructions, or you can't compute the dosage. And you may not be able to navigate healthcare systems, and you may not be able to manage your own health or chronic disease. You may not be able to respond to health emergency in an ideal way, or you may not be confident about your ability to carry out some of the health-related tasks. So given those intermediate outcomes, what you might experience because of the low health literacy is the poor health, financial issues, and the social inequality. And we have plenty of data to support this kind of claims. But I'm not going to go through all the details, but these are sort of like underlying point I wanted to make. So the low health literacy is a public health problems. And I ran this idea with one of my graduate students, and she told me not to do it. But I'm going to do it anyway. So I'm going to say that I started, does anyone play pickleball here? No, okay, it looks enthusiastic, some of the participants. So I started playing pickleball about a year ago, and then my knee hurts and elbow hurts every day, but still I enjoy the game very much. So I wanted to use this sports example to really get the concept of health literacy. So if you wanted to perform well in sports, right, you need lots of things, but two main things. One is the physical fitness. You have to be fit to play the sports, right? And also you have to be able to carry out task-specific skills. So how to swing the paddles, how to move, how to make decisions, etc. I'm not going to go into too much details about the pickleball because it could take so much time. So the point is, even though you have certain skills, if you don't have the fundamental physical fitness, physical abilities, you may not be able to do certain things, right? And also, you can do that in an indoor environment. There's no sunshine, there's no wind, but if you're outside and if it's a little bit different, your performance might not be optimal. So given these ideas, I wanted to bring this to the health context. So our physical fitness when it comes to health is the fundamental skills, including your basic literacy skills, numeracy skills, or problem-solving skills. And then we use these fundamental skills in a specific health context. That's the health literacy skills. So without fundamental skills, you may not have good health literacy skills. And then also the context matters, right? So as I repeatedly saying this. So you could look up some health information at home, and you can sort of think through, understand, and try to use that information. But if you try to do that in a fast-paced healthcare environment, you may not be able to do that. So it probably didn't make sense to most of you, but I tried it anyway. So, you know, if you remember anything from this talk, you can just say, like, presenter talked about the pickleball, but I don't know. Anyway, so another concept I wanted to introduce is what's called Powell-Lawton's press competence model. This is somewhat too academic, depending on what you're interested in. It just shows that compatibility between individual competence or health literacy and the environment. So if you have a lower competence or health literacy, and you see the big chunk of text, like I showed it earlier, you just don't understand it, right? But if I just show the very simple text, okay, don't worry, you're not gonna get sick from the infected cows. Some of the experts, researchers, they want to see more details, so they might not get the best information out of that simple sentence. So depending on your competence, right? How much of information, what kind of information should be provided? This model actually signifies that. So we don't have to memorize this, or we don't have to know, but there is a balance between individual competence and environmental press. Okay, so just to sort of bring all these together, what I wanted to say is that there is a fundamental skills. We need to be able to read, write, and do some simple calculation and use that information to solve some simple, sometimes complex problems. So that's the foundational skills. The health literacy skills is built on that. So without fundamental skills, we may have some issues with the health literacy skills. And even though you have sufficient health literacy skills, there's no way for probably any of us to know every single piece of information about health, right? So just knowing that diet or exercise or cancer or heart disease, there's so much information out there. So there's no way that we can know everything. So most of the time, we need to teach ourselves when the information is needed. Right? So if you want to know something about Alzheimer's disease and the related dementia, that's the time when we actually teach ourselves. But when you actually need a piece of information, if you don't have sufficient health literacy skills, you may have a hard time learning new piece of information. So these things are all related, right? So if you are out of shape and all of a sudden you want to play pickleball, you get injured. You can't play. So you need to stay in shape. You need to watch your diet and engage in regular physical activities. So those are the same concept. Okay, this is not quite relevant, but I just wanted to introduce this idea of how we measure literacy skills in general. So there's a very simple way to measure literacy skills in cross-national research. Does anyone happen to know how we measure literacy? So if I wanted to measure your literacy, how do we go about this? Right, so if you can read and write, maybe. But one of the most commonly used question is, can you write your own name? Right? If yes, you are literate. So some countries might say, yes, our population is 90% literate, but they may not be able to read books because it's the different levels, right? But modern approach is much more complex. So we have data set called PISA or PIAC. This is the international studies, and the number of researchers developed this really sophisticated way to measure your literacy skills. So what you usually do is in front of your computer, you could use the paper, but it's a bit more complex. And you work on literacy tasks. So here's a school, children pick up time rules. And based on these descriptions, what you should do, you pick one of them. Right? Then if you get the right answer, you get more difficult questions. That's what's called an adaptive testing system. So it's not like everyone get the same set of questions and you do exactly the same and the total score is your literacy skills. It doesn't work that way in this modern approach. So everyone gets a different set of questions depending on how you perform. So it's very interesting. And there's a statistical model. Based on your performance, it will give you some range of scores. So your literacy skills should be somewhere around here. So that's how we measure literacy skill nowadays. And it usually takes 30 minutes to 1.5 hours, depending on how fast you can complete the task. So we are in the United States. That's the richest country in the world. So we should be doing better at literacy skills than other countries, right? But my own research actually found that United States, on average, the literacy skill is much lower than other economically developed nations. US seems to have some issues with adult literacy skills on average, right? And then we had a very short but pretty good discussion of what might be explaining why, as the richest country in the world, the literacy skills is not quite there yet. So just to give you some idea, 1 in 5 adults in the United States have low literacy skills. And what I mean by low literacy skills here is very low. So you may not be able to read everyday text. You may not be able to read nutrition fact or some simple books. And in the healthcare settings, so I didn't explain what these level means, but in some of the modern literacy assessment, there are level 1 to 5, and 5 is the highest, 1 is the lowest. And we think that in order to navigate through these complex healthcare systems in the United States, you need at least level 3 literacy skills. But less than half of the adult population has this level 3. So it's very likely that if you are healthcare professionals, if you are in the healthcare settings, some of the patients, some of the clients you interact with, they may not have level 3 literacy skills. So you may need to take additional step to make sure that your message is delivered in a clear way. And the Maryland, interestingly, is, it's got to cut off a little bit, but about the national average as a state, but there is a significant variation across counties. The Baltimore City has 32% low literacy, but Howard County has only 11. So there are some variations across the state. And then, as I said, I'm a university professor. I love pop quiz. So here's another pop quiz for you. I have three. So I will give you maybe 15 seconds to work on this. Somebody says, all of the above. You are correct. All of them are about health literacies. The point is there are personal and organizational health literacies. Okay? The answer is true. Thank you. And then last one. We can do this together. So option number 1, option number 2. Which one would be more appropriate for people with low health literacy? Bad or adverse? Hypertension or high blood pressure? You have the flu or your flu test was positive? Well, I got two different opinions. But you have the flu is probably clearer, right? Your cardiologist is Dr. Brown, or your heart doctor is Dr. Brown? Heart doctor. Your appointment is at 11 a.m., check-in 20 minutes early, versus arrive at 10:40 a.m. to check-in. Thank you. Excellent. So I think everyone gets this. So this seems to be silly. It's pretty simple. But the way you communicate information, depending on whoever you're talking to's health literacy, this really makes a big difference. Okay. So why do people not constantly learn about health information? They have a simple answer. Most of us look for health information only when we need it. Right? So that's another point. And my own research also showed that there is a relationship between literacy, numeracy, and your health information seeking behaviors. But this relationship changes quite a bit depending on your health information needs. So when you get sick, you start looking for information. That's when health literacy matters the most. Some people started, because of the complex health information, some people with low literacy skills, they tend to look at TV or radio, or they just ask some local friends about health information. But people with sufficient literacy skills, they tend to look up information online, read a book, talk to the healthcare professionals. So there's a systematic difference. So when you actually need the health information, the health literacy really matters. So that's the point I wanted to make. And this might be a bit complicated, but it might be relevant to what we are talking about. So health information nowadays, we describe that with 3 V's. Some of you who are interested in data science, you might be already familiar with this concept. The volume, velocity, and the variety. So there is so much amount of information. The amount of information is increasing every day at the fast pace. There's a wide range of health information. So we use these 3 V's to describe what's called the big data. right? Like it's nowadays it's kind of like a common term. So the health information is becoming a big data. So in order to keep up with big data, we need to have sufficient health literacy skills. And then I would propose 3 Ps. One, you need to be prepared. You have to have a good physical fitness. So if you are not confident in your reading and writing skills, practice matters. It's just like a muscle. If you use it, you can get stronger, but if you don't use it, you lose it. So if you're not reading every day, if you're not writing every day, it might be something that we can all think about. And also practice, right? You have to practice the specific skills. So if you wanted to understand the health informations, you should read about health information and practice, try to better understand quickly and more effectively. And then, as I said, as we go through our life course, our health needs, health information needs changes all the time, right? Sometimes it's not just about yourself. My parents may have some chronic disease, Alzheimer's disease, then I need to know more about that. So we should constantly teach ourselves about health information depending on where you are in your life course. So I mostly talked about individual levels, a little bit about organizational levels. So what are the prospective major health organizations are doing? CDC, the Centers for Disease Control and Prevention, have extensive collection of health literacy resources. You can access all of them for free online. And University System of Maryland also has the large collection of health literacy informations. And then they conduct health literacy conference and the lectures periodically. So this is a very good resource. And the other states also have different health literacy projects. So this is just an example, but there might be some other innovative ideas to work with people with dementia in our communities. So we should always be creative and then keep our options open. And that could not only help people with Alzheimer's disease, but also their caregivers as well. And these are just a quick example of Nevada Interprofessional Healthy Aging Network. I was part of the geriatric workforce enhancement programs, and we have developed a series of supporting materials for health professionals, older adults and families, and age-friendly healthcare systems. And this is just one of the examples. We wanted to make a tip sheet, how to interact with older adults. These are just like minor points, mostly for the caregivers. So it's all available online. So I would be happy to provide the link to this website if you are interested in. And then in Maryland, we have also been working on a health literacy project. One of my recent project, the Lifting All Voices project, I worked with University of Maryland College Park researchers and then local nonprofit organization called the Asian American Center of Frederick. So we worked with number of community health workers, multilingual community health workers, to reach out to the linguistic minorities in greater Frederick area. So we developed, that was mostly targeting the COVID-19 and the vaccine information. So we developed those information materials in 11 different languages, worked with multilingual community health workers, and then we did education outreach. So there is an ongoing effort to improve the health literacy environment in Maryland as well. So just to sort of sum up, we are almost done, so hang in there. I know your brain's getting tired, but this is just the beginning for the day. Health literacy research among people with ADRD, Alzheimer's disease and related dementia is extremely limited. It's not just my personal opinions. The recently published what's called a review article, looking at all the published research in the last decade, also had the same conclusion. We don't know too much about health literacy and Alzheimer's disease, so we have a lot more things to do. So at this point, the healthcare providers, patients, family members need to work together case by case and see what works. And each of us has different personality. Each of us has different communication styles. Each of us has different preference. So we really need to pay attention to the individual differences. If you have ever taught any classes in the past, one semester I teach one way and it works great. The next semester it doesn't work at all. And I do certain assignments, some students love it, some other students don't like it. So we always have to make constant adjustment to make things work. So I think we can use this type of educational approach in our everyday settings. So when you interact with people with Alzheimer's disease, we may need to make constant adjustment to make things work. So just to sum up, the health literacy is built on fundamental literacy skills. If you take one thing away from this talk, this is the major point. And we also talked about the 3 V's and then 3 P's. Health information, volume, velocity, and variety. And also, we need to be prepared, we need to be practicing, and we need to be persistent about lifelong learning about health literacy. And our today's session is designed to assist you with interacting with people with ADRD and to have you practice some useful toolkits and to set up for lifelong learning about health literacy and ADRD. So that's all I have for you. Thank you very much for your attention. Yes.